Today we will be performing the 6-minute walk test. The purpose of the 6-minute walk test is to assess the distance walked over 6 minutes as a submaximal test of aerobic capacity endurance. The 6-minute walk test is a performance-based assessment and falls under the activity in the ICF domain. Before the test has begun, the patient will sit at rest for 10 minutes and will have her resting blood pressure, heart rate, and SpO2 vital signs recorded. The test will not be performed if her vital signs include the following: systolic blood pressure above 200 millimeters of mercury or below 60, diastolic blood pressure above 110 millimeters of mercury or below 50, resting heart rate greater than 120 beats per minute or less than 50, and a resting SpO2 less than 88. Before the test begins, the patient will be instructed on the 1 to 10 Borg rated scale for rated perceived exertion as well as breathlessness. For the 6-minute walk test, cones will be placed at the beginning and at the end for the patient to walk around, and there will be 3-meter increments of tape spaced throughout for a total of 30 meters for the patient to walk. Alright, when the therapist instructs the patient to begin the test, the time will begin with a stopwatch. The therapist may follow the patient during this test, but should never lead the patient. If the patient requires the use of an assisted device, they may use so during this test. However, during future follow-ups, the patient must use the same assisted device for reliability and validity purposes. The patient may be allowed to stop, slow down, or rest at any period of time throughout this test, but time must not be stopped. At each minute increment during this test, the patient will report her rated perceived exertion to the therapist. And at 6 minutes, when this test is completed, the therapist will record final vital signs including blood pressure, heart rate, and SpO2. Because the 2-minute walk test has current validity with the 6-minute walk test, the same parameters can be utilized in its assessment of cardiovascular endurance and aerobic capacity. Just like the 6-minute walk test, vital signs will be taken before the test begins, which include SpO2, resting heart rate, as well as blood pressure, which is not assessed in this video. The 2-minute walk test also includes the performance-based assessment, as well as the activity measure of the ICF domain. Like the 6-minute walk test, the 2-minute walk test, the patient will be instructed to walk around the cones at the beginning and at the end of the 30-meter floor. There will be 3-meter increments taped along the pathway to ensure the most accurate distance traveled by the patient. Just as the therapist just did, the patient will be instructed to begin the test and time will be recorded. Unlike the 6-minute walk test, the total distance covered as well as Borg rated perceived exertion will only be recorded at the 2 minutes upon completion, along with the final vital signs.
Today we'll be doing the 400-meter walk test. This test is an activity under the ICF domain and is a performance-type assessment. The purpose of this test is to measure aerobic fitness, but balance and walking ability can also be assessed. Prior to the test, heart rate and SpO2 may be taken. Equipment required for this test include a stopwatch, cones set 20 meters apart, and a clear hallway. Before the test begins, the therapist will go over how to score the Borg rate of exertion. Instructions are given to walk around the cone, and when patient's ready, the therapist will start the watch. The therapist will follow the patient as they complete 10 laps around the cones. Rest breaks are allowed throughout the trial. During lap 4, the patient will be asked to rate their perceived exertion. The time it takes the participant to walk 400 meters, which can include rest breaks, is the time it takes to administer this test. At the end of 10 laps, the patient will again report their perceived rate of exertion, as well as the therapist reassessing their vitals.
The name of this outcome measure is the 10-meter walk test. Under the ICF model, it is an activity. Purpose of this outcome measure is assessing walking speed in meters per second over a short duration. This is a performance assessment. It takes less than 5 minutes to administer, and the equipment you will need is a stopwatch and a clear pathway. 4 marks will need to be placed on the floor, one at the start line, one at 2 meters, 8 meters, and 10 meters. The patient will be instructed to walk at their normal comfortable speed. Patient instructions will be, I will say ready, set, go. When I say go, walk at your normal comfortable speed until I say stop. Start timing when the toes of the leading foot crosses the 2-meter mark, and then stop timing when the toes of the leading foot crosses the 8-meter mark. This can be performed at preferred walking speed or at the fastest speed possible. Documentation should include the speed tested, either preferred or fast. Assistive devices can be used but should be kept consistent and documented from test to test. If physical assistance is required to walk, this test should not be performed. Collect 3 trials and calculate the average of the 3 trials. The name of this outcome measure is the Timed Up and Go test. The ICF domain is activity. The purpose of this outcome measure is to assess mobility, balance, walking ability, and fall risk in the older adult. It is a performance assessment. It takes less than 3 minutes to administer, and the equipment you will need is a standard armchair, a stopwatch, and a cone. This test should be demonstrated first. The patient should sit on a standard armchair, placing his or her back against the chair and resting his or her arms against the chair's arms. Any assistive devices used for this should be placed nearby. The patient will stand with their arms across their chest. They will walk 3 meters to a cone, turn around at the cone, walk back to the chair, and sit down. Patients should be instructed to use a comfortable and safe walking speed. A stopwatch should be used to test the time in seconds. The stopwatch should start when you say go and should be stopped when the patient's bottom touches the seat. Regulatory footwear and customary walking aids should be used. Perform 3 trials with 1 practice trial, and this test can be performed with fast gait speed or with a cognitive task.